on this patient. And she has the typical mid-face volume loss. If you ask her to smile, you can see that this fills out just perfectly, and it's what I did where it fills out. I've marked that, now relax. And it's actually more atrophic than this. I've got some local anesthesia in here. And so, you know, she's got great malar projection. Her lateral cheeks are great, but it's this anterior volume loss that we see with early aging. And if you just ask somebody to smile for me, you can see how nice that fills out. So this usually is a teardrop shape, and it includes part of the tear trough. So we've done some local anesthesia infiltration there, and what we're going to do is probably in the subcutaneous plane, we're going to start here, and I'm using Perlane in this particular case, and we're going to inject, and it doesn't take that much filler. Now I'm pretty deep when I do the cheek because I don't want superficial lumps. I want this to simulate deeper natural fat tissue. And although some people aren't, I'm a big fan of massage. I think that it's really important to homogenize this result and prevent lumps, and I don't think it causes bruising. People get hard body massages all the time and on purpose, and they don't bruise. So I think that that's a bit of a fallacy, and I think that what you do, the improvement you get is way offset by the bruise that you might get. So this little bit will go into the tear trough. And again, massaging this. So you can see how nice that cheek is filled. And we'll progress to this side. Again, getting a little bit up in the tear trough. And a lot of people inject the tear trough from right in the center of the tear trough like this. My results really improved when I started injecting the tear trough from below, from maybe down this far, and injecting this way. And I find that I can put it much more superficial and not get a Tyndall effect. I'm probably still under the orbicularis muscle, and my results are just better, and I enjoy doing that treatment a lot more when I am injecting from a lower point on the cheek. Now there's a little bit less filler on that side, so we're going to put a little bit more here. And how do I know how deep to put it? Basically, I don't want to see bumps on the skin. I want this to be pretty much deep fill. However, if I want a prominence, and generally if you ask a patient to smile, the light reflection of prominence is right here on most people. I will put a little bit more superficial just to make a little mound there. And that is my kind of vanishing point, or my peak of the cheek. I'll put a little bit more in the tear trough, so I'm going to come from low here, and you can see it filling that. Put a little Vaseline on there and scoot it up. So now we're building some really nice cheeks. I think that this improvement, this is what excites me. I love doing this because you can see it happening, and we're going to change her appearance and change her life here. I wish I could get hair that easy. Relax. And I'm going to do a little bit more superficial here. A little bit more superficial here. And you have to tell these patients that we have three things going on. We have local anesthesia that's taking up some space, we have filler that's taking up space, and we have edema from needle punctures. So it's going to go down probably 10 or 15%. But anyhow, I think that's going to be a real nice fill there. I think she's going to need a little bit more right here. And again, I'm playing that light reflex. If you look at a young person and sit them in a chair and put a little Vaseline on their face so you can see the light reflex, and if you look for the areas of prominence in that light reflex, it's going to be right here and right here. A little bit different on everybody, and some people try and make it with measurements and whatnot, but you can just kind of look and tell. So finally, we've got a little bit left here, and we've numbed her lower lip. Let's open here, and we're gonna go right into the wet-dry line in the center of the lip, and that's where we deposit our filler for deep volume. And we're just putting a little air in the tire here, and I've numbed her lip. I numb every single filler patient that we do, and then we'll lubricate that and massage that a little bit. So that's 2 syringes of Perlane, cheeks and lip.